from getpharmacyadvice.com, and I just got home from the gym, did a hard workout. Now I feel like I might like to vomit. Toshi's turn. And there's no better time to talk about vomiting than when it comes to having taken a medication and you have vomited. Now, we are going to talk about what you should do if you have vomited after taking a medication. So, the general guideline is that if it's been 15 minutes or less than 15 minutes after you've taken the medication and you vomited, then you definitely want to redose yourself because most likely the drug was not absorbed. You'd also want to redose if you see the tablet or capsule in the vomit itself. So those are the instances where you definitely redose. If it's been 60 minutes or longer, so if it's been an hour or longer, then you should probably not have to redose. I would not redose because the medication's probably gone past your stomach already and absorbed into your system. Now there's a gray area where if it's between 15 and 60 minutes, you have to kind of weigh the risks and the benefits of taking medication again versus not. So if there's an instance where the risk of not taking medication outweighs the risk of getting too much of the medication, then you definitely want to redose. So for instance, if you're on birth control or HIV medications, there's a risk that you wouldn't get enough, and then so if you're taking birth control to prevent pregnancy, if you didn't get enough of the medication, then you may end up getting pregnant because the hormone levels aren't high enough. And then with HIV medications, it's always very important to keep on schedule and take every single dose. So in those instances, the risk of not getting the medication outweighs the risk of getting too much. So you would definitely want to redose if you vomit within 15 to 60 minutes of those types of medications. When it comes to, let's see, Lariam's a good example. Lariam is an anti-malarial drug. You definitely want to redose that medication if you vomited within 30 minutes. Malarone's also an anti-malarial drug. You'd want to redose that medication if it's been within 60 minutes of taking it and you vomited. So if you vomit anytime from 0 to 60 minutes after taking Malarone, you want to redose. After 60 minutes, you're fine. When it comes to long-acting opioids such as methadone and Oxycontin, you definitely do not want to redose in that 15 to 60 minutes. You may get too much of the medication otherwise. So in that instance, if you have fast-acting or immediate release pain medications that you can take for any breakthrough pain you may experience, then you definitely want to hit those up until the next dose of the long-acting pain medication is due. Let's see. Also, for narrow therapeutic index drugs such as warfarin and digoxin, you would not want to redose in that 15 to 60 minutes because those can reach toxic levels very quickly. You may want to consider taking it if there's a strong concern that your levels are already too low, in which case you'd contact your doctor because they're following your levels fairly closely, or they should be anyway. Also, any other medications that are known to have high toxicity or commonly can become toxic or side effects are toxic, then you would want to err on the conservative side and not redose that medication within 15 to 60 minutes. So just get to know what medications, the side effects of your medications, and get to know your medications well so you can judge better on this whole gray area. Also, if you are on an antibiotic, such as Zithromax, and you're being treated for an acute infection, so that in that case your regimen or the therapy isn't going to last very long. So this Zithromax is typically 5 days long. If you vomit within that 15 to 60 minutes after taking it, you definitely want to redose. It's important to get that dose in so you can get rid of this infection. So any anti-infective or antibiotic that has a short course regimen, so you're not taking it for very many days, then you definitely want to redose as well. I think that's about it. I guess the most important part of this is that if it's been 0 to 15 minutes and you vomited, then redose no matter what. If it's after 60 minutes, no matter what, do not redose. And in that 15 to 60 minutes, that's where the gray area is, and we discussed that, so you can go over the video as many times as you need to get the info. I think that's about it. If you have any questions, please find me at www.getpharmacyadvice.com, and I hope to see you soon.